My name is John Russis, and I'm the Director of the Mobile Stroke Unit and Regional Director for the Jefferson Neuroscience Network. Today we celebrate the innovation and collaboration between Jefferson Health System and Bensalem EMS. We are so thankful to so many of you who have been with us every step of the way. This day has finally come. Today marks the culmination of an idea that began many years ago and is truly aligned with the vision of our president, Dr. Klasko, and Dr. Rosenwasser, and that is healthcare with no address. We are excited to announce the Mobile Stroke Unit today and extending our mission of improving lives with our partners here at Bensalem EMS. Please join me in welcoming Dr. Robert Rosenwasser, President of the Vickie and Jack Farber Institute of Neurosciences at Jefferson, Professor and Chairman of Neurological Surgery, along with many other prestigious titles here within the Jefferson Health System.
It's a real pleasure to be here, and I want to thank the mayor who ordered the weather. We were talking about that earlier, so thank you very much, Mr. Mayor. We really appreciate it. And in about an hour, you'll be able to go through and see the unit, and I think you'll find it really impressive. This is an idea that that Ms. Pam Kolb and I really started talking about, who's the executive director of our Neurological Institute, about 10 years ago. And then Maureen DePrince came on board, and John came on board. So, you can't thank everybody because you always forget somebody, and then you get in trouble. But there are a lot of people who have really made this happen. And I'll just tell you a little bit about the origin of this. So, this actually, I was over in Germany. I periodically would go over there and operate at the University of Tübingen, which is in the southern part of Germany, and help train their residents. And so I saw this probably about 15 years ago. And Germany has 18 counties. There's one university in each county, probably as it should be in the real world, right? And so all the high-end disease, cardiac disease, stroke, would, due to resources, would go to the university hospital. And that's really where the light bulb went off. And it's so critical, music to our ears, right? Another siren. So critical in something that's a time-sensitive disease. And why stroke? Why would we do this? Well, if we look at the U.S. alone, there are about 750,000 strokes per year in the U.S. alone. It used to be the third leading cause of death when I started in this. It's now the fifth leading cause of death, but it is the leading cause of disability by a factor of 5. $40 billion a year we spend on care of stroke patients. $40 billion per year in the U.S. alone. So you can see the impact it has to the patient, to the family unit, to society, and so forth. And it really dwarfs many other diseases that sometimes are a little bit more high profile. For example, Parkinson's disease, important disease, right? But 20,000 a year in the U.S. compared to almost 1 million stroke patients. So it kind of puts things in perspective. And why did we choose Bensalem? Why did we choose this region? Well, it turns out that I've had the good pleasure, and my colleagues have had the good pleasure of taking care of many patients who were delivered by Chief Topley. And the Bensalem EMS unit, just like you see what we do, we kind of get a sense of all the EMS units in the region. And it's really a world-class EMS unit. And I owe Chief Topley and his colleagues a real round of applause for the job they do. We thought a lot about it. Dr. Wydrow, who has medical command in Bucks County, was really influential as well. And where's Jerry? Huh? There you are, Jerry. Okay. So Dr. Wydrow was really instrumental, and we had a lot of discussions because, it's like the first case has to go right, And this is our first venture into this. We're the first university medical center in our region to have this. And so picking our partners and people that can deliver, it's kind of like picking the baseball team or the football team. You got to have all people that hit 300. And Bensalem EMS hits 300. So I really want to really thank, again, the mayor, Chief Topley, for doing this. And I think that we'll have time for questions. I'm about to get the hook because I think I'm talking too long. So at this point, I would like to introduce Chief Topley. We've had he needs no introduction.
I think it's great that we're able to introduce this to our community right before EMS Week. EMS Week's next week. And I really like to thank all the people that were involved in this. Dr. Rosenwasser's vision to bring this to Bensalem is really going to benefit our community. I'd like to take a moment to just talk about Bensalem Rescue Squad for a minute and why we thought it would be a good fit. Bensalem Rescue Squad's been here since 1980, and I've been here for 34 years. I started as a volunteer when I was a kid. And the one thing about Bensalem Rescue Squad and all the public services, emergency services in Bensalem Township is we like to really get the job done. We don't worry a lot about pomp and fritz, and we like to get the job done. And we have one of the best teams at Bensalem Rescue Squad. In the 34 years I've been here right now, we're able to move on all cylinders. We do a lot of things. We do a lot of CPR training in the community. We have a lot of AEDs in the community. We do a lot of training. We're able to do this from the support we've got from our mayor, our council, and our community over the years. We have a lot of resources other rescue squads in the region don't have. So we were quite honored when Jefferson approached us to bring this truck to our community. So the stroke program is really important to us because we're able to get a job done that we were unable to do before. We're actually going to bring world-class neuroscience to your driveway, and that's not done anywhere in the region. And the fact that we are working with a university health system is going to put this truck way above anyone around us in terms of being able to do care and provide new innovative treatments to our neighbors, not only in Bensalem, but in Lower Bucks County. We're hoping to reach about 500 people a year with this service, and we could not do that without Jefferson's help and Dr. Rosenwasser's vision and the mayor's support, our council's support, and the support from our community. So thank you very much.
Just like life is all about making a deal, right? And when we first talked about this, it was very important to have the support of hospital leadership and health system leadership. And I've known Mr. Richard Webster, gee whiz, probably 20 years. I think we first met when I used to operate a Pennsylvania hospital. And my wife was an anesthesiologist there. He used to, I think, boss you around when you worked in the OR. But Mr. Webster really has always been supportive of new ideas and new concepts, and it's not always about, the first question, it wouldn't be how much is this going to cost. The first question would be, is this something that's really going to make a difference in what we do, or is it just another gadget? And so Mr. Richard Webster is the president and CEO of Thomas Jefferson University Hospital and the Jefferson Hospital for Neuroscience, and really has been a partner with Pam Kolb and myself to really move neuroscience forward and to get it out to the community. And with Mr. Webster, he's a president of the hospital who it's always about patient care. It's not always about the budget and the bottom line. So, Mr. Webster.
I've worked at Jefferson for over 20 years, and I've had the pleasure of seeing the growth and expansion of the Vickie and Jack Farber Neuroscience program. And it's just been amazing professionally to be able to see the advances in technology and the improvements in care. But when it really is meaningful is when it hits home on a personal level. And it was probably about 5 years ago where I got a call from my mother at work. And my mother never calls me at work because she knows how busy I am. So of course I thought it was a family emergency, and in fact it was. One of my cousins had a ruptured aneurysm and was being airlifted down to Jefferson to be taken care of by our neurovascular team. So I dropped everything I was doing, and I ran over just as quickly as I could. I went down to the suite where they do these procedures, and they told me, oh, she's up in the ICU now. So I said, okay. So I ran up in the ICU, and I prepared myself to go into the room and see someone who was probably pretty ill and not completely functioning. And I walked in, and she said, hey, Rich, good to see you. I haven't seen you since the barbecue we had last week when you bought the mashed potatoes. And I was like, wow, I almost forgot that. But truly, that's the impact that this service has on patients in our community. She was actually in a car accident that was caused by the fact that her aneurysm ruptured. She was airlifted. She went to a community hospital, part of our neuroscience network, was airlifted down to Jefferson, was treated, and was now sitting up in her room eating lunch in just a matter of a few hours. So thank you for all that you do for the patients in the community. May is actually Stroke Awareness Month. And I think many people know that when it comes to a stroke, it's all about time. It's recognizing the signs and symptoms of a stroke, and then it's getting that patient to the right site of care so that they can be treated just as soon as possible. There's medications that are used that obviously can reverse many of the symptoms and the impact of stroke, and that is the true value of this mobile stroke unit. They'll now be able to, as you mentioned, be able to provide this care in someone's driveway. There's a mobile CT unit within this truck. The right staff will be there with telemedicine capabilities. They'll be able to talk with the right people, get the right diagnosis, and provide the right treatment right there before the patient ever is actually transferred to an emergency room. At Jefferson, we say we improve lives, and I think this absolutely will improve lives of our community. We're proud to be a partner with the Bensalem paramedic program, and it's really my pleasure, and I'm very happy that this is now actually coming to a reality, because as Dr. Rosenwasser mentioned, for 10 years we've had discussions around this unit, and to see it actually come to be is really gratifying. So thank you everyone for being here, and look forward to the tour. So next I'd like to introduce Ed Terzansky. Ed is the chairman of the Jefferson Northeast Hospital Board and a huge supporter of this program as well.
Ed. I'm chairman of the board of the Northeast Division, which is the old ARIA Health System. So it's Frankfurt Hospital, Torresdale, Bucks. And we're so thrilled to be part of Jefferson for a lot of the reason you've heard. It's world-class care from one of the world's leading academic medical centers that brings us capabilities to a mission that I discuss at every board meeting. I tell my board members, my doctors, nurses, and other staff, there is not a single day that goes by where someone doesn't bring us a loved one. And their most fervent hope is that they encounter two things in high measure. The first is compassion, the second is competence. And as Tom said, the capability that is coming to Bensalem through its rescue squad is what we're going to see in that rush that Rich described, where time is of the essence because of the nature of stroke. We may be the ones who deal with the stroke on the back end, but the Bensalem Rescue Squad, they're the people who are going to get your loved one to us so that we can deliver that care. And for that reason, we are thrilled to be here. We congratulate our friends in Bensalem. I have to quickly mention Frank Peraza, who's one of our Northeast board members, said to me, you know, how many years ago, Frank? How many years ago did you get the funding for this? Yeah, he said he got the funding for the extension here, and which is really just a demonstration how deeply ingrained we are in the community. By the way, I acquired a wife from Bensalem. She's had me for 35 years, so everything about us is community, it's sharing. We are so very happy to have this relationship with the Bensalem Rescue Squad, and we're thrilled that their capabilities have grown so that together we can carry out our mission to save your loved ones, to give them the quality of life that you want for them. I'm proud to introduce at this time one of the key players at our hospital who greets your loved one and is responsible to make sure that your loved one gets the kind of care that he or she needs. Please welcome to the microphone Dr. Jerry Wydrow, the head of emergency medicine for Jefferson Northeast.
Excited to be here. This is excellent for me because this brings two of my worlds together. I'm a practicing emergency physician, the chair of the emergency department for Jefferson Northeast, but also a very active emergency medical services physician, a pre-hospital physician. I've had the absolute privilege of working with EMS colleagues all throughout Bucks County and have what is truly a privilege being the regional EMS medical director for Bucks County. Know the folks at Bensalem EMS very well and really do see this opportunity, this marriage as something that's very special. You have to acknowledge what is really the focus, the drive that brought this together. Really, at the end, Dr. Rosenwasser, who's been not giving the full detail of how much he drove this, and Dr. Klasko to bring something that has not been done in this region before, really to life, and it's quite impressive. We have to remember that this is a special time for this ribbon cutting. First off, this is Stroke Awareness Month, and we should all recognize that a stroke happens every 40 seconds. This is real. The potential for death, for severe disability is real. But it's also the beginning of EMS week on Sunday. And EMS week is something that we don't always recognize the people that answer the call. Day or night, rain or sun, come out and bring life-saving intervention. But EMS week this year is something special. EMS strong beyond the call. That means that we have to remember that it's not just about the 911 response, but all the other pieces that EMS brings. And what are they bringing to that? Well, they're bringing special changes that might include evaluating somebody in their home, that might be special innovative treatment like you see behind us, the mobile stroke unit. Abilities like that are what make it different and why beyond the call is so telling and why we really felt strongly that having this ribbon cutting at this time was so important. Dr. Klasko challenged all of us on his team to go look at healthcare beyond the hospital. Healthcare with no address. Forget about the brick and mortar. Well, nothing is going to be farther from that or closer to that goal as having a mobile stroke unit. As has been talked about, we classically measure success in treating certain types of stroke in what's called a door-to-needle time. The time they hit the door of the hospital or the emergency department to the time the needle goes in the arm to give them what we call the clot-busting drug, or TPA. Well, we're changing that paradigm. Now it's going to be the curb-to-needle time, curbside of this unit, the ability to get a high-quality imaging study of their brain and then see a specialist, a neurologist or neurosurgeon who is able to pinpoint where the disease is and determine whether that drug should be administered. All of that's going to happen in a very rapid fashion, and we cannot understate the importance of that. This only works because of partnerships. And really my role today was to be someone who could identify good partners. And we know that our colleagues in Bensalem, so our public safety director, Fred Horan, who is somewhere, serving food, it looks like, executive director for Bensalem EMS, Chief Topley, Dr. Alvin Wong, who's one of our emergency physicians, but also will be the medical director for the mobile stroke unit here for the EMS side. Because of those partnerships, and then the partnerships that Jefferson brings, we're able to bring this to the lower Bucks County community. So we will go beyond the borders of Bensalem as we utilize this service to treat the right patients at the right time who need it. I want to thank everybody here for coming and also the opportunity and the privilege to be involved with such an exciting program and something that is truly cutting edge. Don't forget EMS strong beyond the call. I always say, give an EMS worker a hug. Where's Bailey in the back? We can give Bailey a hug. Do not forget your EMS partners, the people that answer the call when no one else will. Thank you.
Ladies and gentlemen, at this time I'd like to introduce the Executive Vice President for Government Relations for Thomas Jefferson University Health System, Mr. Hugh Lavery. Hugh's going to introduce some very special guests we have with us. Hugh?
Thanks, Ed, or Mr. Chairman. Thank you for your service to our board. Thank you, Dr. Woodrow. I'm looking in the audience and I see my friend and colleague, Dr. Rosenwasser, who's an incredible leader, Mr. Webster and Pam Cole, my colleagues. And I've had the privilege of working with them over the past decade on Neuroscience's initiative. So seeing this come to fruition is just incredibly exciting. I have the privilege of representing Dr. Klasko here and expressing his pride in this development. And I will say that none of this happens without the support of our elected officials. And the first individual I want to introduce actually is somebody very important to this town, Mayor Joe DiGirolamo. Mayor, you and I had a close and late mutual friend. We'll talk about that offline. We've met before, but it's great to see you again. We have an inextricable linkage to this town through our patients, our employees, our medical alumni who live or work in this area, obviously the hospitals under Jefferson that are in this area. So we're very proud of that association. I take the train from Cornwallis Heights. We've been to different events on Street Road. So it's a many-headed hydra, but this is certainly a proud moment for us and for Bensalem. The mayor's tagline, I think, for the city of Bensalem, for the township of Bensalem, is improving the quality of life in Bensalem through teamwork. He's been the mayor of this great township for 25 years. So without further ado, Mayor Joe DiGirolamo.
Good morning, everybody. What a great day here in Bensalem. We look forward to these days. Bensalem likes to do first things first before any other community, and we get that opportunity with Jeff, and we're certainly very grateful for that. Two quick things. 25 years ago when I came into office, our ambulatory, our rescue squad was bankrupt. We were in desperate needs. We put a team together, and Tom Topley was there from the very beginning. I don't know where Tom went. There's Tom there. I put a team together. We brought this rescue squad back to the #1 in Bucks County, and I would say in the state of Pennsylvania. So that has been done. And that has been done through a lot of hard work and teamwork, as I know you do at Jeff, of everybody there. It's all about teams. The second thing, how important this is. On a stroke, able to go out and answer those calls to save lives. Firsthand, a little over a year ago, my wife had 2 strokes, and by the grace of God, got in time to a hospital. And it was not by ambulance, but got her there. But just in case another 5 minutes went by, might not have made it. These are the kind of things important that, Jeff, you are providing for us here in Bensalem, and hopefully it gets bigger throughout Bucks County. It's a very, very important part of the healthcare system. So we're very, very grateful to have that here. I know we'll make it work through Tom Topley and his team, and certainly myself and council and all of us working together. So again, I thank you for giving us the opportunity, and we will not disappoint you. I can guarantee you that Jeff Health will be very, very happy on how Bensalem handles the program. So we're looking forward, not to a stroke victim, but we're looking forward to saving lives here in Bensalem Township. I would also like to say Senator Tomlinson was supposed to be here. He could not be here today, so I wanted to, obviously, Senator sends his thanks and wishes and for the opportunity we receive here in Bensalem. I'll tell you, Bensalem's a great place. I don't know how many of you live here, but if you don't, you should. All right? Just remember, if you're here, you'll have a stroke. You have the first shot at it. God bless all of you. Thank you so much. At this time, I'd like to bring up Councilman Joe Knowles, President of our council, say a few words.
Yeah, I'm Joe Knowles, President of Bensalem Council, and on behalf of Bensalem Township Council, we'd like to thank Jefferson and the Bensalem Rescue Squad for does a tremendous job, and it really serves our community. I was telling the mayor, my father was the mayor's doctor when he was a kid, and that was a long time ago, believe me, but when the mayor was a child. But my father graduated from Jefferson Medical School, so he was serving the community of Bensalem for decades. And then by coincidence, he wore an Army uniform, I understand. I'm the 9th kid in my family, so I wasn't around. But my mother from Cornwallis Heights flew to Germany, and he served in a hospital in Germany and married my my dad in Germany as a medical doctor over there, Jefferson trained. But you know, when my dad in the 40s and 50s and 60s and 70s was treating people in Bensalem, he had a little black bag, you know, with a stethoscope and a flashlight, I guess, you know what I mean, a blood pressure thing, you know. But he was trained at Jefferson, so he did a good job. But you know, now we have the equipment that is the greatest technology available to anybody in the region. So we already have a tremendous first responder system in Bensalem, our police, our firefighters, our EMS, and now we have the equipment necessary to help people. Any residents in trouble, you're going to have the best opportunity to be saved in Bensalem, and we're very proud of that. And thank you for Jefferson for providing us the equipment that's necessary to save people's lives.
Thanks, Council President, and thanks for mentioning that, connecting to Jefferson. What a prideful moment for us to know that your dad went to such a great medical school. We have a little bias there. It gives me great pleasure, pride to introduce State Representative Dean G. Girolamo. You may recognize the name. He is the chairman of the Human Services Committee in the State House. Issues that surround health care, Medicaid. He's been a champion on the opioid crisis in the Commonwealth of Pennsylvania, and a real friend to Jefferson and to health care delivery in the Commonwealth. So welcome, Mr. Chairman.
Good afternoon, everyone. Good to be with you. This is an exciting day for Bensalem. I came a little late because I had just taken my mom, who had a stroke about a year ago, to St. Mary's Jefferson for an appointment with her, follow-up appointment with her neurologist. And when she had her stroke, April was a year. Of course, it was early in the morning when she first got up. We called Bensalem EMS. They were here within a couple minutes, picking her up, taking her to St. Mary. And she was very, very lucky because, as been mentioned many times, time is of the essence. That's why this is such an exciting day. And she's recovered very well. She's got a little bit of vertigo right now. And the doctor, Dr. Natter, asked her what she was doing. And she says, well, my cleaning lady gave me a couple of exercises to do to help with the vertigo. And I told the doctor, well, we don't have to come see you anymore. We'll just go to the cleaning lady for some follow-up. But just an exciting day. And Tom Topley and Fred Horan, who is our Director of Public Safety, and all the people here, the team, the staff at the Bensalem EMS, they already do an amazing, phenomenal job on behalf of the residents, not only here in Bensalem, but across the lower part of the county. And now with this partnership with Jefferson Health, and I know I've known Ed Trzanski for a long, long time. And my good friend Frank Peraza is here also. Frank is a Bensalem resident. And me and Ed's wife actually went to grade school together for 8 years at St. Charles. So, I mean, it's just amazing. But with the help of the mayor and the council, Senator Tomlinson, this is going to be a great partnership. This partnership with this mobile stroke vehicle is going to save lives here in Bensalem. Absolutely will. Great partnership, and just glad to be a small part of it here today. And thank you all for being here. And as the mayor said, God bless each and every one of you. Thank you.
I'm going to turn it back to Maureen DePrince. Just want to give a quick shout out to Dr. Jabbour. I'm sorry I didn't see you before. It's good to see you, Dr. Jabbour. And Maureen, thank you.
Hi, everyone. I'm Maureen DePrince. I'm a nurse at Jefferson and have had the privilege of working with Dr. Rosenwasser and Dr. Jabbour, as well as some of the top neuroscience physicians and nurses in the country. And I'm so privileged to bring you this MSU program, the Mobile Stroke Unit, here today. It really is going to change lives for patients in the community. So next up on the agenda, we have our ribbon cutting ceremony, followed by lunch and then tours of the mobile stroke unit. I encourage all of you to ask questions, whether it's about the equipment, the technology, the brain rescue team workflow, about stroke in general, because we want you to leave here today knowing more about stroke and what you can do to prevent a stroke from happening. In off hours for the mobile stroke unit, we will be using this truck to be proactive in preventing a stroke. We want to be as proactive as we are reactive when it comes to stroke. So if you have a community event, a health fair, something going on at a senior center, we invite you to call us, and we will work with you to bring this mobile stroke unit and the education that is so desperately needed to the community. 80% of all strokes are preventable, and I think that's a very powerful statement, and everyone should walk away, understanding what that means. And if you know your risk factors for stroke, you can, and control those risk factors, you can prevent a stroke from happening. So leave here today, we want to be reactive in our treatment of stroke, but we also want to be proactive. So I look forward to working with all of you in the future as we, raise awareness in the community, particularly during this, month of May, Stroke Awareness Month. I think we can all leave here and go home and share information with our family and friends.